Good afternoon. Welcome to another episode of Spilling Tea. I'm your host, Tiffany Daniels, and as promised, we are reopening the mini-series on Medicaid, considering the threat that current Medicaid coverage is under right now. We're going to cover this first. We will get into supplemental security income in its own mini-series as well. There is a lot of stuff that is interconnected. So, what we're going to be going over now is we're going to have a little bit more details for you folks so that you can get a better understanding in regards to Medicaid, with it being the kind of gatekeeper into the service system, exactly what all of that covers, which is extremely important. This is something that the general public, unless they have someone who's a part of the service system in their families, are not really familiar with. They're not really well aware of exactly all the costs involved without Medicaid that would be coming out of pocket. We'll get to all of that as we go through the series. So, what we're going to be going over today, and I am, of course, going to have the link to this, as always, right there in the description box, is what services are covered by Medicaid for children with disabilities. Now, this is a main primary focus on children. However, a lot of these also cover into adulthood. Remember, a lot of us in the service system, we go from child support to transitionary services into adult services later on. The Medicaid pays the bulk, the majority, for all the different services that fall underneath the service system umbrella. So, we're going to go ahead and start going through this here, but first, a few kind of trigger warnings real quick. I do want to mention, we do have this channel marked not for kids for a reason, mainly because growing up an army brat and half raised by a truck driver, I use explicitives a lot. Sometimes I don't even notice when I use them. So I like to have that up ahead of time. Folks, if you have kids that are watching this 16 and under, parental supervision is very much advised, alright? Good. Okay. So, let's go ahead and get into it. Medicaid covers things that most health plans offer, like doctor visits, hospital stays, and emergency care, but it also offers special services for children and adults with disabilities. Ask what benefits your plan offers that relate to your child's needs. Alright, so let's go ahead and begin, shall we? Early and periodic screening, diagnostic, and treatment, also known as EPSDT services. Medicaid programs in all states are required to cover these services for children under the age of 21. They include diagnostic tests for autism and other developmental disabilities, and help ensure that children are screened and treated for potential health and developmental conditions. Now, as I was 18, when I was finally properly diagnosed with autism, and I've told you guys before, previously, starting after second grade, I was incorrectly diagnosed as ADD. Remember, that used to be a thing, just ADD, before we realized there was more to it than that. But I digress. Early to mid-90s, that's its own subject. We may go over that one day, who knows. But essentially, for me at the time, living with my aunt, I fell under their insurance, which was Blue Cross Blue Shield at the time. That's one of the biggest companies for healthcare in our area. So, my diagnostic tests and all of that was covered with that money. But after I left and I went into transition services, the first assisted living apartment, By that time, if my Medicaid had not been accepted, we're talking within a few days of my graduation back in 2004. You want to talk about being up a creek without a paddle. For real. Because that assisted living had the services within those apartments. So we're not just talking about getting help with rent here. We're also talking about what we would now reference as direct care staff for folks like me back then that didn't really need that much direct care support, but instead very much needed assistance in getting ourselves integrated in our communities, help with living skills, finding ways to be able to navigate the community with sensory issues, with, not losing our heads, balanced checkbooks, eating healthy. All of those general services that I was getting within that assisted apartment complex, all of that, those services were covered through my Medicaid that I had at the time. If I had not been accepted into Medicaid, I would have probably not been able to get into that program. Those assisted apartments, they are not cheap. And a few of them that happen to be around is very much a testament to that. I haven't really, since having left there years ago, have not really come across that many types of programs that are like that. Other than Sassafras, which is out here in town, where quite a few of my friends happen to be. So Medicaid covered all of that. One time, I can't even remember where it was, got a peek inside a file of what those costs would have been had I not been on Medicaid, and what Medicaid was getting billed for regards of services just for myself. And I'll say this now, I'm not trying to shame anybody. My services were fairly minimal. More of a support. I didn't require more around-the-clock direct care support like many of my friends did. But still, even with that being said, what Medicaid was covering for me in regards to the transition services I was engaging in at the time, and this is just for the assisted living apartment. This does not include the services that I received from ARC in regards to job coaching and assistance in obtaining jobs out in the community, as well as quite a few other things. It was, and this was just for a singular year, it was sitting about around $100,000. $100,000, folks, for the scope of a year. I'm doing fairly well these days. General income yearly consistently for over the last 7 to 8 years has sat around about $34,000. That's, not including what I've put into Social Security, as well as what was being covered through work insurance, but $34,000. If I were just starting out today and trying to get into the Medicaid service system, and under the new eligibility criteria, I know damn well I would not qualify whatsoever. Anything that I would need in regards to that would either come out of my pocket or there would be no services at all. And any kind of small dream I ever had of actually being able to live out independently, fully on my own, with supports in place that are there if necessary, would have been non-existent. That's just under current Medicaid. We're talking about the tightening of the criteria that happened around back in the 2010s. We are now talking about even further cuts than what they did at the time. So keep that in mind. We'll go ahead and continue to read this here as well. All right, this includes addressing developmental delay, hearing, vision, mental health, oral health, autism, and more. Now, when you are a child, there's also an intermarrying of services too as well within the education system. There are a few services and supports that Medicaid covers if direct care staff needs to be included in regards to public schooling, for example, or if in order to best be able to participate with everybody else in the classroom, if assistive devices might need to be necessary, as well as the more traditional supports like myself being able to test in a silent room where I was the only one in there. I didn't use that very much, by the way. Not at all, except for SITs before graduation. That was pretty much it, but thank God. Thank God, because that could have gone so bad. Anyways, so, covers developmental delay. It covers services and assistive equipment in concert with the overall special ed department within public schools. Also covers in case somebody from ARC or Borough would need to come out and kind of educate the teachers if there was that particular need. That's not free, folks. That is not free. Let me go ahead and continue here. Personal care attendants, PCAs, or as they're better well known, direct care service workers is what we call them out here. They use the term direct service workers to help care for your child at home. This is for people who cannot take care of their own daily needs like bathing, eating, dressing, and moving around the house. Remember how I told you those folks who live very wonderfully interdependently over in the Sassafras apartments? Those folks are paraplegic. For that reason, they do need assistance exactly like what it's talking about here. Eating, bathing, dressing, moving around the house. Some of them, due to being terminology medically fragile, do have a separate room with a bed for their direct care staff to be able to stay overnight if needed. Usually they utilize that in particular if there's been a recent surgery that they have gone under or any other type of kind of more invasive medical care, so that they'd have somebody trained to keep an eye on them. If you've ever looked into hospice services before without the help of insurance, it should give you a pretty decent idea in regards of just how expensive that is. And when you're dealing with folks who need help with all of that daily care, if you cut Medicaid the way they're talking about hitting Medicaid, you can say all you want to, GOP, that those who really need it are going to get it, but here's the truth, because I've been through these cuts before. It affects everyone. Everyone who is on Medicaid. Point blank, period. We're talking cuts in regards to transportation. We are talking a little less time with direct care staff because there's just simply not enough to go around. We're talking about individuals who, due to tightening of criteria in spite of having a very deep, easy to see, plain as the nose on my face, services and supports being cut out because as of right now, there just isn't enough to go around. Again, these services are not cheap, especially when we're talking about these types of services. Let's continue here. based on your child's needs, you can get a certain number of hours per week to hire a PCA to help with these tasks. And then once as the kids get older, like sassafras age, they go from having the parent be able to help to being literally solely leaning on direct care staff. Over at Sassafras, the direct care staff handles all, hear me on this folks, all of those basic services, cares, and assistance. Many of these folks are older, their parents have passed away, not everybody has siblings nearby, a lot of these folks are only children, so Medicaid is funding, literally, they are the only source in regards to being able to have the direct care staff these folks need to be able to continue to survive. Okay? If you really think with the multi-billion-dollar cuts that they're trying to make right now, that those folks like them over there at Sassafras are not going to feel it, I got the most glorious ocean view, perfect property out in Kansas, palm trees and all that I'll sell to you for a single copper penny. Okay? How do I know this? Because I've already seen it happen. We are currently right now still under those 2010 cuts, which gutted, literally gutted the service system. Right now, they are surviving on a skeleton crew already. If they make the cuts that they're going to make, we may be facing a situation where you'll have regional offices like the one I worked at start closing down. Or where they would have to do a hiring freeze. Less case managers, less social workers. And boy, you don't want to know the horror show that would be. It also has places like ARC without that funding. If more funding gets cut, that is less experienced direct care workers that work under them that they are going to be able to hire for these folks out in this community. Okay? And you know what? It may be indirect, but the impact on some of the most medically fragile out here, the impact is direct. Okay? That means fewer people to be able to care for those who do have all of those needs. And folks, direct care work is one of the highest burnout types of professions within the healthcare field. It is stressful, folks. Sometimes you have direct care workers working with some hostile individuals. Sometimes just the overall workload, especially since you've got right now direct care workers doing double duty. So they're not just dealing with the daily care of one individual. Due to some hiring freezes, you have a singular direct care staff that within a given day may have to serve 10 different folks daily, in regards to that more intense level of day-to-day care. I don't care who you are. Eventually you are going to burn out. And with those freezes, guess what? Yeah. Let's continue. Therapies like speech, OT, and PT, special equipment or devices. Remember, not just for living at home and in the community, but this also ties in very much with special education. Those assisted devices assist in regards to education for all of us. All right? Okay. Diapers or pull-ups for children over 3 or 4 if their disability makes them incontinent, or not being able to have control of bowels. I have seen this, again, with many friends, not their fault. A lot of those folks, well, there were a couple people over there that they're not paraplegic. They have what's called post-polio syndrome. I don't know all the ups and downs of post-polio syndrome, but I do know at least 2 of them, literally from the chest down. I should say, neck down, are paralyzed. Okay? Neck down. Imagine how much care they need. Imagine how much that adds up. Now, add on a hiring freeze and a high stress, high burnout type of job position that hasn't seen a raise in hourly wages in probably at this point more than 20 years. And you'll see the mess we're already in. That is how things are as of right now. Wrap that around your brain. Let me go ahead and continue here. Medical also has benefits that help pay for transportation to your medical appointments. So out here in Missouri, we have a transportation unit that's called OATS that's used by primarily a lot of the seniors who are on Medicare and Medicaid that have a more difficulty getting around. They're about my grandma's age, upper 80s, coming into the 90s. It's used by folks who have cerebral palsy and a few others with developmental disabilities that give it difficulty trying to navigate things such as the bus system, for example. So the OATS will come out and they will pick them up and take them to their appointments, surgeries, what have you. And then OATS will pick them up and take them back home. And it is what we call it MoDOT here now, but Medicaid is what helps cover the cost of the OATS van that runs to get them over to Cox or Mercy. The federal government requires state Medicaid programs to cover certain services, and states can opt to cover extra services as well. Now, we're going to go over this here. It's going to be a quick list, but first we're going to finish up this page, okay? Alright, so other services from your state, with or without Medicaid. Each state has an agency or office that offers services for children and adults with disabilities. You may be able to get services from this office, whether or not you have Medicaid. There may be more services available if you have Medicaid, so be sure to ask. Out here in Missouri, no. Out here, Medicaid is the gateway to the service system. Now, technically, places like ARC and Borough will take out-of-pocket payments. But again, the costs for even the minimal amount that I was utilizing straight out of high school is insane. And if you're already on a limited budget and you're doing something like supplemental security income, you're boned. You are boned. Fucked up shit creek without a paddle. Okay? You're Jimmy Hoffa with an oil drum. I know I use it all the time. I can't help it. It's one of my favorite new ones. Alright? Out here, if you do not qualify and get Medicaid, you don't get into the service system. Because Medicaid covers all of it. MoDOT is what covers the case management from the Missouri Regional Office Department of Mental Health under the division of DD. You don't get Medicaid, you don't get served. Point blank. And before you get served, here's how it goes. Diagnosis, full functional behavioral assessment, Medicaid acceptance, and then you would go to the regional office and begin to start with getting those case management services. Why those are important, folks? Well, these are the folks, again, it's a gateway. These are your guides that use the full functional behavioral assessment to go over with you what are the best treatment programs, if there's in-home supports we're going to need. These are your conductors into the service system. Okay? They cover a variety of different tasks, from keeping a superficial eye on group homes and places like Crowhaven and like Sassafras to some of all the other things I was mentioning to you earlier. You don't get Medicaid, you're fucked. Point blank. I know this because I found it out the hard way. About 2008, I was working with the state. It was my first year. Back in the time period where $12.50 an hour was huge. It was still only part-time at the time period. I was only working about 4 hours a day, unless it was the 6 months of conference season. But because on SSI I was making over the $900 amount that I had to keep my bank account at, or I'd lose Social Security and lose all my services, guess what? Those services got yanked, much to my very, very bad detriment. Okay? I know what I'm talking about here. It's not good. Not at all. Alright. Now we're going to go ahead and pull up that list. Alright, here we go. These are the mandatory and optional Medicaid benefits. Some of these we've already gone over. I just thought we should go ahead and go over the list. So, that's transportation to medical care, inpatient hospital services, outpatient hospital services. So this covered my therapy. It covered my psychiatrist, my psychologist, my neurologist, my counselors. It covered my job coaching and their assistance in helping me obtain work out in the community. It also covered my half the day during my last 2 years of high school of going to college for graphic arts associates. Yeah. Let me continue. I'm taking you in left field. Sorry about that. Rural health clinic services. This is vital, especially for a state like mine. Missouri is in the majority rural, especially out in the southwest area where I am from. So, getting those clinic services closer to you, especially when transportation is an issue, is absolutely vital. Federally qualified health center services, laboratory and x-ray services, nursing facility services, early and periodic screening diagnostic treatment services. This is used primarily from those of us folks who spend our lives broke and we need that extra money that would usually go to our employer's insurance program to pay for things like food. So something like this could help work for parents and adults as we get further down the line to be able to cover those getting tested, getting diagnosed. Okay. Allow me to continue. Family planning services, tobacco cessation counseling for pregnant women, physician services, home health services. So that's the direct care staff that we've been talking about here. Nurse midwife services, certified pediatric and family nurse practitioner services. So that's a little bit what we've also gone over too. For our elderly folks, this also is one of the primary funders out here for hospice services. Because I don't know if you've ever looked at the cost of hospice, but if you think my minimal services is expensive, if you ever looked at some of those bills, you want to talk about getting an education and being traumatized. I haven't recovered. Let me continue down the list here. Freestanding birth center services when licensed or otherwise recognized by the state. Medication-assisted treatment. Routine patient cost of items and services for beneficiaries enrolled in qualifying clinical trials. For those of us starting new medication. I never did, because mainly the types of medications that I responded to the most were the ones that have been around for a while. Even now with Paxil, that is the case. I think they told me that. All finished up for that one around 2013, 2014. But yeah, I think this gives you a pretty good rundown in regards for those of us with developmental disabilities, physical disabilities, our older folks. All of this is covered by Medicaid. All of it. So let me be quite frank here. I do not believe for like 2 seconds that there's somehow millions of people being 150 years old and dead that are collecting Social Security. There may be one or two. There usually is with any system. Medicaid is not special in that regard. Look at our welfare system. Okay? Look at our welfare system. But cutting into that money is not going to stop individuals from trying to con money out of people. What it does do is remove funding from folks who need it the most. Because whether it is direct or indirect, those cuts means less skilled direct care staff to be able to take care of those who do need that daily assistance. You see, that's where the impact is. You could not lose your services, but with the money being cut, having the folks there who are the best trained to be able to see and take care of you suddenly starting to go the way of the dodo, because cost of living and cost of what they get hourly paid is not going up. There's fewer and fewer direct care staff all the time because of burnout, because of the stress, because they're already on a skeleton crew. Where you should have one direct care staff person per person, you've got one person handling 2 people in a single day. So, the people who really need it will keep their services are still going to be impacted. This is why people need to turn their brains on and shut their mouth in regards to things that they don't understand or have the information on. And turn on your computer and do some research. Hopefully I can help in some of that. I'm not trying to be derogatory or mean, but when you have someone like Elon, the brain dead guy who has been on my shit list far longer than it's been popular for him to be on there, threatening to take a chainsaw to this specific program. And I know damn well his rich ass has no idea what kind of impact that is going to have across the board. And folks, I'm sorry, it will be across the board. There is no way to get around it. Well, that's kind of why I do what I do. why I'm cynical and use so much profanity while explaining it. We're going to go ahead and close out for this one, folks. We don't get very many views on this channel, and the few we do tend to get removed from time to time. So please don't forget to hit the like button, hit subscribe. Please don't forget to hit the comments. Before we go, I do want to announce that I will also be opening up a mini-series as well into supplemental security income. A rather pertinent topic these days because Elon the moron has declared it a Ponzi scheme with not having the slightest idea of what the hell he is talking about. So we're going to be starting to get into that as well. I do want to dig a little bit more into Medicaid first, in particular because these two do tie so tightly together. We also are going to be getting into IDEA and IEP because now it's pertinent. Because Trump has gotten rid of the Department of Education. The Department of Education is what helped to pay for things such as special ed, as well as help fund things such as IDEA and IEP. So, a lot of work to do, folks. A lot of work to do and many miles before I sleep. I hope you all have a wonderful rest of your day. I'll be seeing you all tomorrow. Bye-bye now.